Since 2008, I'm practicing Ayurveda dermatology. Out of all the patients that I have consulted or I have seen, about 20 to 30% of patients, whichever came to me, all said that they have already taken Ayurvedic treatment from someone else, right? What I found in that, in those patients, 20-30% of patients who have already taken treatment from some Ayurveda doctors, what I found in that is about 60% of patients had no prescription at all. They said that previous doctor has not given any prescription to them. Okay, even if given, even if given, the prescription had short forms of the medicines which were known only to the prescribing doctor, right? Which were known to only prescribing doctors. Now, in remaining patients, what I found was all the patients, all the patients were given same medicines. All the patients were given almost same medicines, even though they have not consulted same physician, right? They are consulting, like, one patient consulted Dr. A, another patient consulted Dr. B, third patient consulted Dr. C. But all the A, B, C, and D, and so on, if we see the prescription is same. The prescription is almost same. Means the medicines in that prescription are same. Means the pattern of prescription, how they are prescribing, what medicines they are prescribing, they all are same in treating all the skin diseases, right? Now, what are those medicines that we found, or what I found in those prescriptions? Common or most common are these: Kadirarista, maybe agreeing with that, right? Very commonly prescribed Kadirarista, Mahamanjista Adikada, Arigordin Rasa or Arigordin Vati, Gandhaka Rasayana, Aishwar Gugulu. One more important is that Panchatikta Gugulu Gruta tablet. Very important. Tablet, not Gruta. Not Gruta, tablet. Okay, Marichadi Taila for external application. Sometimes Nimba Taila for external application. Now, can we consider this type of treatment as all are prescribing same medicines? Pattern is same. Can we call it as a kind of standardized treatment approach, or can we call it as standardized treatment protocol of Ayurvedic dermatology for all the skin diseases? Can we? Whether the conditions were same. Now, though they are prescribing same medicines, no problem. Whether the conditions are same or not. Whether the conditions are same. No. Surprisingly not. The conditions were completely different. What are the conditions? Like fungal infections, eczema, psoriasis, acne vulgaris, urticaria, herpes, allergic skin disease. You name any skin disease. You name any skin disease, but the medicine prescription or the pattern of prescription is same. Same medicines are prescribed, right? With this approach, can we expect successful results? Like, let any patient come, we'll prescribe same medicine. Will we get successful results? Never. Never. Then what should be the right approach? What should be our approach? Namaste, myself Dr. Mahesh Savalagimath. I'm practicing Ayurveda Dermatology and teaching Ayurveda since 2008. Welcome to my channel, Dr. Mahesh speaking. And today we are going to discuss Ayurveda Dermatology, the science of right prescription, right? The science behind prescribing a medicine in skin disease. Science, because why I'm calling it as science, because it needs efforts to learn and understand it, then bring into the practice. So that is why there is a science behind prescribing medicines in skin diseases, right? Right, all the skin diseases are treated with same medicines, right? As per the report I told, right? So what is there in that prescriptions? 6 to 8 medicines, 6 to 8 internal medicines, two kashaya, two asavaristas, one or two tablets, one churna, another churna, something like that, 6 to 8 medicines in the same patient. And this is true with all the skin diseases. All the skin diseases, same medicines, almost same pattern, copy paste, copy paste, copy paste. But the outcome is very, very poor, very poor. And importantly, dermatology is a very, what you can call, a high scope field of Ayurveda practice. Ayurveda can do a lot of, Ayurveda can give a lot of benefit, better results in the field of dermatology. And in that, if we keep on doing this type of practice, what will happen? See, one thing keep in mind, whether we treat 100 patients successfully or not, that is secondary. If out of 10 successfully treated patients, here and there one patient may refer you one more patient. But if something goes wrong with one patient, if condition gets aggravated in just one patient, out of 100 patients you have treated successfully, that one patient will block 100 patients that are about to approach you. That is very important. We should never think that today patient has come to me, let me treat, tomorrow whether it will come or not. No. Follow-up is very important, friends. We should be able to maintain the follow-up of the patient. When it is possible, when we are giving them the results, right? When we are giving them the results, right? It's not like, highway dhaba, like whoever, so passing people will be there, or a hotel in the bus stand, right? Passing people, quality, no problem, even if you compromise with that. Only one time the person is hardly coming, once or twice in a year coming, no problem. It's not like that. Clinical practice is something which is continuously done. And patient recommendations, word of mouth itself is the source of what you can call growth of your clinical practice, right? So it's like blindly shooting multiple arrows at a target. Blindly shooting multiple arrows, like 10 to 8 or 6 to 8 drugs are put into the patient's body. Let any one of them catch the maybe right and it will catch. Right? What will be the chance of outcome, successful outcome, or the arrows hitting the bullseye? Very, 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 very less. Very less. Because we are not precise. We don't have, we are not, targeting, we are not aiming correctly. So that is very important. Now then, is it wrong to prescribe prescribe such like 6 to 8 medicines or prescribe these medicines? You may ask me, are they not effective? 100%. They are 100% very potent and very effective. But the question mark. Question mark means in which conditions they are effective. In which conditions they are effective. That is very important. It's not about right or wrong. It's about being such prescriptions being right is very less. Right? Outcome. Outcome should be the prescription should be right. That is very less, very poor. Right? Now there may be other some questions like, is it wrong to prescribe same medicines to all the patients? No, no, it's not like that. It's not wrong. In my 16, 17 years of dermatological practice, I prescribed very few medicines, very less medicines I use in my clinical practice. Then what is wrong? But the problem is precision. How precise we are. It's not like prescribing all the medicines in a single patient. No. Which medicine should be prescribed in which patient and in what time should be important. In what stage they are to be prescribed. All of my teachers have always said to me, they keep on telling that we should prescribe minimum medicines. We should prescribe minimum medicines. So that minimum means precision. We should be precise in prescribing the medicines. So that is where the importance of understanding the science behind prescription in Ayurveda dermatology lies. Right? There are many principles. There are a number of principles that are that can be used in our practice of Ayurveda dermatology. In that three, I'm going to discuss today. Okay, I'll make sure you will understand them. Listen to me carefully till the end. Hmm? And if you are new to my YouTube channel, please subscribe also. And if you think this video is worth, please like and also share with all your friends. Three principles that we are going to discuss today. The first one is dosha association in the given condition, dosha association. Second one is, okay, we have assessed the dosha, we prescribe the medicine. But when we prescribe the medicine, that medicine will have, if we have prescribed the right medicine, that will bring some changes in the doshas, because we have, like for example, pitta was aggravated, so we gave something which is going to having pitta hara effect or pitta shamana effect, so that reduced now when the patient came to you next time. At that time the condition has changed now. So assessing the dosha association at every visit. After every prescription, when the prescription is over, patient consumes that medicine. Okay, then again we need to assess, and for that we have to prescribe medicine. And the last one is selection of medicines. We'll see them one by one. Now, in practice, we get such patients, right? See, these are four patients are there. All the four are having different presentations, right? I think you all agree that these four patients, all the four have different dosha associations, right? You all agree with me, right? Yes, you all agree. Now, imagine those 68 medicines that I have given list. If we prescribe same medicines in all these four patients, what will be the chance of result or successful outcome in these four patients? Can we predict that one? No, because we are blindly prescribing. We are blindly prescribing. Not neither we are assessing the formulation nor we are assessing the condition. We are blindly prescribing. Take for example, just psoriasis only you take. For example, just psoriasis. No, these patients, all are psoriasis, all have different clinical presentations. Presentations are different means that means dosha association is different. Dosha association is different. Can we prescribe same Kadirarista in all these patients? Or can we prescribe same Mahamangistadi Kada or Arigordini or Gandhakarasine in all these patients? No, you can say no, we cannot. But they are prescribed. But they are prescribed. We are prescribing like that, right? Many times we prescribe like that. Such things should not happen. Many prescribe like that. At least I can say I'm not telling that I'm good. It's not like self उसके बारे में ज़्यादा बोलना वैसा नहीं है. But I'm in dermatology since 2008. I do not treat any other disease. I practice only dermatology. I read dermatology. That is why I'm telling the chance of these patients getting cured or getting better results with the same medicines is very, 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 very less. Very, very less. Right? So that is why association of dosha. We need to understand dosha association in a given patient. Whichever patient comes to you. Actually, do not require much time. It's like it is said like all the indriyas pursue at once. It's like that only. Like whether we have to spend time for assessing vata, we have to spend time for assessing pitta, then we have to spend time for assessing kapha. It's not like that. When you look into that, you start concentrating in few days, maybe a week or a month, you start getting that capturing what are the major doshas, what are the presentations, what dosha dominance is there, what medicines I have to prescribe. It's very clear. Observation is the key. Okay. The second one is changes in dosha association at the end of every prescription. Right? I will show you with a case. But very importantly, as per the YouTube community guidelines, we should not prescribe the medicines here. We should not tell the medicines. So that is why I will not be telling the medicines. But I think you will understand what medicines I'm giving hint about which medicines, right? Okay, because as the YouTube community guidelines say that if we tell medicines for particular condition and all, chances of self medication will be there. So please forgive me for that. Okay, but I'll make sure you understand. Okay, let us take this case. The patient came with these lesions on both the legs. Okay, right leg main was affected. Left leg, you can see the auto amputation of some of the digits have started, right? And patient is having this since 8 years. And this whole part, both the foot is not having sensation at all. I think you are getting what the condition may be. So when we look into the condition, what is there? It is kapha pitta dominant condition, and it's a viral infection. Okay, it's a kapha pitta dominant condition as per the dosha, and etiology is it's a viral infection. So what should be the medicines? Kapha pitta hara. Okay, slightly rachana also no problem. Kapha pitta hara. Antiviral. Trimigna or Bhutagna they should be, and must and should be Kushtagna, right? Those medicines were given in this patient. When we look, as I said, Kleda is more, Kapha Pitta, Kleda is more, so we need external also. See, I have given one formulation, one kashaya, one tablet. External now. Internally, one kashaya, one tablet. Externally, Kleda is more, Kapha Pitta, so Kleda is more. So, what I gave him the Kleda Hara Sega. Kleda Kushtagna. That drug should be Whatever we use for Seka, that should be Kushtagna, Kledahara. And as we are seeing them, they are appearing like Runa, right? Wounds. So Vrunahara or Runa Ropana, that type of drug should be there. But that was given for the Seka, external application, right? This was on 29.6. This is 13.7. Now you can see still slight Kapha you can make out, and it is more appearing like Runanu, like a wound it is looking. So Kapha more Ropana. Previously, Kapha Kledahara, I told you with little Rechana property I gave. Now what I gave, more Ropana property, but Kapha and that antiviral kind of effect was maintained, but simultaneously they are Kushtagna. Those were given. As Kleda is still there, so continued Seka, washing externally with the Kushtahara, Kledahara and Ropana type of drugs. Clear? This is on 13.7. 27.7. Now, condition got aggravated, right? You can see Clay is increased. Why? Because it was rainy season and patient walked outside. I told you there is no sensation at all. Patient walked outside in the rain and clay got increased. Clay got increased. Now, again kapara is needed, but more clay dahara. More clay dahara, afagna, kafahara, with more clay dahara effect. Antiviral kushtagna, same type of medicines were prescribed. And clay is more, so again, external application was continued. 27, 7 to 9. To 9. Okay, with 15 days no medicine, patient came. I usually give medicines for 15 days. So with the gap of 15 days medicine, no medicine for 15 days, then patient came. Now you can see marked reduction is there. Marked reduction is there. Continuing, condition is much improved. Slight vruna is still there. Now what is needed now? We need more ropana now. So I prescribed ropana property drug, Kushtagna, antiviral. And externally, Kleda is no there. Kleda is not there. So stopped Seka. Not washing now. I gave oil for external application. Again, the oil is Kushtagna, Kledahara, Kafahara, and Ropan. Right? Vruna, slight Vruna is still there. So Ropan. This is on 20 to 9. And you can see 1910. 1910. More than 98% improved. Right? So, as I told you, loss of sensation and it is viral, viral infection. So, I wanted to maintain antiviral effect drugs, Kushtagna, Krimigna, and Bhutagna type of effect. So, that was continued and oil application for external application. Oil for external application was continued. The patient got completely healed. You can see here the auto amputation has completely stopped, and here you can see the gapping, right? That means completely healed, right? Completely healed, right? Probably next month, 6 months later, he will be coming to 2 plus 2, fourth month, no, or 4 months later, I think, February. I told him to come after 4 or 5 months, and he will come. What will be the condition? If possible, I will upload about that also. So, what you saw here, the dosha association is changing as per the prescription and other things. External factors also, like I told you, walking in the rain, right? So as per that, we are going to change the medicines. We have to change the medicines that we give for internal use. Even external therapy also, you can see, started with Kledahara, Seka and all. Once Seka, Kleda got completely reduced, we stopped that, we switched to oil only, right? Clear? So this is what second thing that we have to assess. Dosha assessment in the beginning. Next, dosha assessment at every visit. At every visit, we have to do dosha assessment. Accordingly, we have to prescribe the medicines. Right? Clear? I think it's clear, right? Okay. You can see 29.6 and this is 1910. Condition with loss of sensation, history of 8 years, non-healing. All the modern treatments have failed. All the treatments are taken. No change. You can see one. The outcome. Oh, sorry. I went back. Sorry. You can see auto amputation it was taking place. You can see there is no gapping and all. Now gapping has started. Okay, fingers are becoming separate and auto amputation has stopped. Right? Okay. The third principle. Okay. So can we prescribe before we go to third prescription? I will ask you few questions. Some questions. These were actually asked to me. in one or other workshop or so. That's why I'm asking. Can we prescribe Shirabala Taila or Balaswagandhari Taila? Shirabala Taila or Balashwagandhari Taila in psoriasis with more dryness? Tell me in the comments. Can we prescribe Shirabala Taila or Balashwagandhari Taila in a psoriasis condition with more dryness? Can we? No. No. You may ask why not? Why not, right? Why not? Why not we prescribe? In dryness dominant psoriasis, there will be vata aggravation. And these oils are very effective against aggravated vata. Then why we should not prescribe them? Because though they are vatahara or vatagna, but rogagnata is not there. Though they are vatshamaka, but they are not kushtagna. They are not kushtagna. Right? So that is why for selection of medicines, again there are several principles. Again, three we will discuss. The first one is the context of the formulation, where that formulation is explained, or the rogagnata of the formulation. Whatever formulation we are prescribing, what is the rogagnata of that? Now, for example, Ksheerabala Taila, Vatavadi. Right? It is Vatavadi. Vatahara, Rukshata, it reduces. But it's not Kushtagna. Why it's not Kushtagna? Because that is Kleda, that increases Kleda. If you apply, there are instances where Ksheerabala is applied in psoriasis and psoriasis got aggravated, and aggravated, like, psoriasis got converted into, clinical presentation like that of eczema. It started oozing pustules and all. Why? Because it is Kleda Vardaka. Ksheerabala or Balashwagandhari are Kleda Vardaka, so it should not be prescribed. So what should be the right option? Iladitaya. Right? Shoshaka. Kleda Shoshaka Pushtagna. First thing is, context is Pushtagna. Right? It is Pushtagna. Clear? It is Pushtagna. Next, if itching is there, Kushtagna, and it is Rukshatahara, Snigdha. So, Rukshata, it will reduce. If itching is there, again best, Eladi Taila. Vata, Ruksha dominant, itching. Eladi Taila. Right? It is Snigdha, Vatahara, Kushtagna, and Kanduhara. Kandu Kota. Correct. So, we can give that. But not Shirabala or Balashwara. Right? Doshagnata. That's what I was telling. For example, you take Nalpamaradi Taila, and Eladi Taila. Both are Kushtagna. Can we use them anywhere? In any skin disease? No. Because Eladi Taila is Kafavatahara, Snigdha, Kanduhara, Kushtagna. Right? Vishagna, Kushtagna, Potahara. Nalpamaradi Taila, Pitta Kafara or Kafapittahara, Kledahara, Runaropana. And it stops spreading. Chori Churuna Visarpa Kushta means itching dominant skin disease with more pitta, which is spreading. Visarpa means don't take there, it literally like, herpes type of presentation. No problem. In herpes also you can prescribe. But something which is spreading, that spreading is because of pitta just spread, not due to vata spread. Vata also chala. Right? Gati is there in vata kushta also. But pitta type of gati, when it is spreading, more erythema, more burning, more itching. At that time, we can go with nalpamrita. If there is more erythema, more itching, consider as Eladi is Kanduhara. Eladi is good for reducing the itching. If we give Eladi Tela, presuming that it is good for itching, what will happen? The condition will get aggravated. Because Doshagnata. Kushtagna, okay, but Doshagnata, it is not right for that condition. So that is one. Okay. Next is karma. What is karma? What is karma? For example, consider there is a visarpa, herpes type of presentation is there. Okay, it is pitta dominant. Right? So we have a formulation which is Pittahara, Pittagna, Kushtagna, but not Rechaka. If we prescribe, we cannot expect 100% result because in herpes type of presentation or in Visarpa, we need Rechana property. We need Rechana also. So that is karma. That is karma. Doshagnata is there, Kushtagnata. Kushtagna, Doshagna. But karma, whether it is doing Shoshana, whether it is doing Ropana, you can see in that patient I told you, Ropana dominant, Kledahara dominant. Like for example, Limbadikasha is more Ropana dominant. Aragodad is more Kledahara, right? Asnadi Kashaya. Asnadi Kashaya Kushtagna. Hmm? Medahara, Kledahara, right? So like that, karma should also be considered. So first thing is context, whether the drug is Kushtagna or not. Second is Doshagnata, which dosha it is suitable, for which doshaja, skin conditions we have to prescribe it. After that, in a dosha, which type of presentation, whether we should prescribe it for daha, karma, daha shamana, whether we have to prescribe it for itching, anduhara, whether shota is there, whether we have to prescribe it for shotagna, shota, shotagna or not, kushtagna, pittahara, shotagna or not. Like that, we have to assess. So when we do all these things, what happens now? The precision of prescription comes. The precision in the prescription comes. There are many such principles. There are many such principles. If you learn, you will become expert in treating dermatological manifestations using Ayurveda, which has got highest score, which has got highest score. If you have seen, if you have watched till now, if you are watching till now, that means you are a really open-minded person to update your knowledge and skills. Am I right? Am I right? Are you interested in learning Ayurveda dermatology? Are you willing to enhance your knowledge and skills? I'm not telling you don't know Ayurveda dermatology. You have. You are practicing, that is why. If you want to improve it, if you want to improve it, if you are interested, if you are open-minded to improve your knowledge and skills in Ayurveda dermatology, I have created several courses. The one important course is package of 50 hours online Ayurveda dermatology course. It's completely online. It has got two courses. One is 30 hours psoriasis management mastery in Ayurveda. It is 30 hours online, completely online. Pre-recorded videos will be there. You can download our app, or you can browse with the web. What is that? Web browser only, no problem. So there you have 30 hours pre-recorded videos. Anytime you can watch, as many times as possible you can watch, and you can access this for lifetime. Lifetime access is there. And in each and every video, below that there will be comment. If you have any doubt, you have to type there, and that will come to me. And every 10th day or 15th day, I conduct live sessions where we discuss about those questions. I solve those questions. I answer those questions. And we discuss one new case which is not already there in that. Already the course is having several cases, but new case again will be discussed. Okay, it is completely online, lifetime access. As many times as possible, you can watch them from anywhere, provided you have a laptop or a mobile and internet connection. And time. Very important is time. There is one more in this package, that is dermatological manifestations of Visha. I call it as Ayurtoxic dermatology. Dermatological manifestations of Visha means it includes contact dermatitis, allergic dermatitis, all allergic skin conditions, drug-induced skin diseases, bites and stings induced skin diseases. It has occupational skin diseases, all these skin diseases. In this, again same, 20 hours pre-recorded videos, anytime you can watch as many times as possible. Same, it's applicable, same. Live sessions will be there periodically to answer your questions that you write in the comments. And they are self-explanatory. You can, if you are able to understand my this video, then you are 100% going to understand that. Okay, so that's simple English, no difficult to understand. Okay, if you don't want to directly invest into the package, it's 7,000 rupees. Actual cost is 11,000 or something it comes. If you are not interested to invest so much of money at once, which is more than worth. I can say that some 6 to 8 times worth content is there inside these courses for whatever you make payment. Okay. If you are not interested in joining the package, you can join individuals also. Like same 30 hours psoriasis management mastery. Only that you can join at just 5,999. Okay. For all these courses, I will be giving links in the description. Okay. You can join that Ayurveda dermatological manifestations due to Visha 20 hours online course at 2599. If you still not sure to invest in my courses, means if you feel that I may not be worth to invest your money and your time, then there's a short course, 3 hours. It's again pre-recorded, 3 hours workshop or training session, application of Ayurvedic principles. application of principles of Ayurveda dermatology. It's again case-based understanding. See, in all my teachings, whether be it seminar, conference, or classroom, or these courses, there is no something called theory. Nothing like theory. Everything is practical. Everything is patient-based. Patient, what medicines I give, what prescription I prescribe, everything I put everything. I explain why also. I explain why, even dose, why it was given like that. Everything is explained, and it's made like that because if one fine day a patient comes to you and you don't have the same medicine, if you want to prescribe same medicine, if it is not there, then what you are going to do? Then you should know the science behind that. That is taught here in these courses. So I'm giving links for all these in the description. Please try them. They are 100% beneficial. You will excel in your clinical practice, if not in all, at least in dermatological conditions, right? So aerodermatology has got a huge scope. Lots of scope is there, and I always request everyone. I am even today. I learn many things like yeah, about softwares and all. I keep learning. I keep investing on self. Self investment is the best investment. You should invest in self, provided that investment yields 10 times, 20 times more than what we invest. Always be open minded to update your knowledge and skills because Charakacharya says, Vishak Mumurshur Matiman Atha Swaguna Sampadhi Param Prayatnam Atiste Pranada Sadyata. But he says, even if a Vaidya, Pranada Vaidya, very knowledge, highly skilled, such Vaidya can also get confused at times in particular patients. So that is why Swaguna Sampattihi Param Prayatnam Matiste. So for enhancing own quality, one's own qualities, knowledge and skills, why they should put lots of effort, always keep make efforts to learn knowledge and skills, because as the time changes, presentations change, lifestyle change, right? So that is why we should be always learning, updating our skills. Okay, thank you for watching this video. Hope I was useful. I was able to give something new to your time. Investing that much of time, some 20 minutes or so, or 30 minutes in this video was useful. Thank you so much. Please, if you like this video, please press the like button. If you are new to my channel, please subscribe. And if you feel the video is worth, please share this video to all your friends. And please don't go without checking the description where I have given links for all the courses. Wish you all the success. Namaste. See you again. Namaste.